Hello, everyone. This is Hallie Cloud, and thank you for joining us today. For those of you who are new to our Beyond the Basics webinar series, this is a project of the Center on Budget and Policy Priorities, which is a nonprofit policy think tank in DC. This series is designed to provide training and resources that explain health coverage available through Medicaid, CHIP, and the marketplace. It is intended for navigators, advocates, state and local officials, and others who help consumers get and keep their health coverage. Today's webinar, Assisting Consumers in Plan Comparison and Selection, will present strategies for helping consumers compare and select qualified health plans in the marketplace. It will highlight key things that consumers should consider, including balancing monthly premium costs and deductible amounts, understanding cost-sharing differences, identifying if current providers are in-network or if specific medications are covered, and comparing consumers' total out-of-pocket expenses for the year. The webinar will also feature a live web browsing demonstration via Healthcare.gov to explore the plan comparison process using current plan information. So with that, to guide us through our topic today, please welcome Dave Chandra, Senior Health Policy Analyst with the Center. And with that, I'm going to turn it over to Dave. Thank you.
Great. Thanks, Hallie, and good afternoon, everybody, and good morning to those of you still out on the West Coast. I'm very excited to join you all. We're 10 days into Open Enrollment 3, and so far it seems like we're hearing the site has been working very well for folks, and so we're looking forward to this being a very positive experience for consumers that are either coming back or are new to the marketplace seeking coverage. As Hallie mentioned, I am here to talk about plan selection and comparison, and did want to note that in addition to my role here at the Center on Budget, I volunteer actually with a lot of colleagues, both here at the Center on Budget and in a lot of partner organizations here in DC, as volunteer CACs in Northern Virginia. And so a lot of the information we're going to be sharing today actually has come from direct experience with some of the consumers on the front lines. And those of us who only do it once or twice a week realize how intense of a job it can be. And so I really do applaud all of you who've been spending your full-time jobs doing it for the past year, 2 years, or 3 years in these open enrollments. So with that, we'll get started. We're going to talk a lot about health plans and specific details about them, how to talk about them with consumers, and then we'll pause halfway through to take questions. And then we'll go in the second part and do the live web browsing demonstration with Healthcare.gov. So just wanted to remind everyone that we did a webinar a few weeks ago on plan design, and the webinar is available on the link here, and you can find it on our website. It talked in great detail about a lot of the key basic elements related to commercial insurance. We're not going to be repeating a lot of that since we assume most of you all will have had a chance to see that one. If you haven't had a chance to see that one, or if anything we present today seems a little confusing because of some of the underlying terms that we use, you're more than welcome to go back and watch this webinar or any of the other resources we have there to help you clarify some of that. But it really talked about the components that made up health plans. Today we're going to dive into great detail about some of the trends we're seeing in health plans in the marketplace, as well as key things to keep an eye out for and different ways that health companies are selling insurance products for consumers. So also wanted to note that in the past month and a half or so, we've been providing specific webinars to state-based networks of assisters. So as you can see on the screen, we have about 20 that we've either done already or are planning to do over the next week or two as a way to sort of tailor this type of presentation to your state. And so for those of you who might have already seen some, there'll be some things that'll be similar or duplicative, but we do have updates today that is the new site for Healthcare.gov that we didn't have prior to the launch of open enrollment, and so we're very excited to feature some of the new tools and aspects of Healthcare.gov along with 2016 plan information. So to get started, we'll really cover the fact that there's 5 primary elements to any health plan that's sold in the marketplace. And there's the monthly premium, which I'm sure all of you are familiar with. There's the cost-sharing design, and so we often refer to that as the plan design. That includes things like deductibles, copays, coinsurance, and all of those details for each plan. There's also the benefits and covered services that a plan has. And for the most part, the Affordable Care Act standardizes every insurance plan, so they cover pretty much the same thing. There's a tiny bit of variation, which we'll cover on a little bit later on. There's the drug formulary, which are the prescription drugs that the plan covers. Again, every plan has to include prescription drugs and has to have all classes of drugs have some options, but they may not cover all the same drugs. Or they may treat the drugs differently, as we'll see in some later examples. And then lastly, there's the provider network, which is the doctors and pharmacies and hospitals and places you can go to receive the medical care that's included in the plan. So just wanted to show, Healthcare.gov has had a redesign, and so the new site that we're going to be working with is the web browsing site, the sort of window shopping plan display site that we're going to use later on. And it looks very similar to last year, although it has some update in terms of the information it includes. And so it includes, this is just an example from my hometown in Western Pennsylvania of a plan, the cheapest bronze plan in that area. And like last year, you'll be able to click on the link of the name of the plan, and it'll take you to the plan detail page. So this lets you have a lot more information available, including not just the deductible and out-of-pocket maximum, but significant detail as you scroll down on information like the copays for all the different doctor visits and prescription drugs and hospitals. So very thorough and comprehensive information available as you're searching on this site. At the top of the screen, you'll notice there's a link to the summary of benefits. And as most of you should recall if you're returning, the summary of benefits is a document, if you click on it, that'll pop up as a PDF for every single health plan sold on the marketplace. And this includes even greater detail in a very uniform fashion across all plans about things like the deductible, how much it is for individuals versus family, is there a separate deductible for prescription drugs, and as you scroll down, it has more information about things like the doctor visits and diagnostic tests and prescription drugs. And in addition to the amount of the copays, it also has things on the far right that might have any notes or sort of limitations that might apply. So it's a very useful tool. Certainly encourage you all to use it when you're sitting with consumers as a way to sort of get better information or even print out a copy to give to your consumer if they end up picking one of these plans. So to start, we're going to dive into cost sharing and some of the key trends in cost sharing. And to do that, I wanted to present something we've been doing over the past year and a half, which is when you talk to consumers about things like cost sharing and copays and deductibles, we know that many of them have a lot of difficulty in understanding some of these concepts. Some of our consumers haven't had insurance in the past before, or even if they have, these terms are quite frankly quite complicated, even for those of us who work on it every day. So what I've done in the past when sitting with consumers is literally sit and take a piece of paper and draw out sort of a visual diagram of what some of this stuff means. So for example, you can have a consumer and say, for the course of your year, you and your family will have a total amount of medical expenses, a certain amount, whatever it is. It might be a lot, it might be a little. And let's say you have a plan that has a deductible of $1,500 and an out-of-pocket maximum of $5,500. So what you explain to the consumer is at the beginning of the year, any medical care they get, they'd actually be responsible for the whole amount of those charges. And so in this case, it would be for a total of $1,500. Once they've spent out of their own money $1,500 on medical care, and that might be over the course of a month or 3 months if they're really sick, or maybe it takes 9 months, but at that point, they've now hit the deductible, or you can say they've met the deductible, either way. From that point moving forward, any medical care that they and the family members get, they now split the cost with the insurance company. The consumer will just pay the copay or the coinsurance, and the insurance company will pay the remainder of the bill. So as they're paying copays and coinsurance through the course of the year, those amounts are going to add up. And in this case, once those copays and coinsurance add up to an additional $4,000, that $4,000 plus the $1,500 they've already spent at the beginning of the year equals $5,500. So they've now hit or met the annual out-of-pocket maximum. Again, for some consumers, if they're very sick, that might be in the middle of the year. For others, it might be at the end of the year. For many consumers, they actually don't even hit the out-of-pocket maximum. But if a consumer hits the out-of-pocket maximum, from then on until the end of the calendar year, any medical care they get, the insurance covers the entire amount of the bill, and the consumer doesn't pay anything. So this is a very oversimplified way to describe some of these terms, but it's sort of a starting point to help consumers become very comfortable, especially with things like deductibles and out-of-pocket maximums, which will be one of the most important things they'll be evaluating when trading that off between that and cost. So let's talk about some key things to keep an eye out in some of these cost-sharing elements. The first thing related to deductible, as those of you know who have seen in previous webinars or any of our state webinars, is on Healthcare.gov, they'll list prominently in the center the value of the deductible. In this case, for this example of a plan sold in Arlington County, Virginia, it's a $2,500 deductible. And when you scroll down on Healthcare.gov, they'll show information for doctor visits and for hospitals, and there'll be a section for prescription drugs as shown here. And one of the rows will be the prescription drug deductible. So in this case, there's a value of $500. So that means that there's a separate prescription drug deductible of $500 that the consumer would hit. If a consumer has medications that they fill, they'd be paying the full cost of those medications until they spend $500 of their own money. And once they've done that, they've hit the prescription drug deductible, and now they would just pay the copays and coinsurance for prescription drugs. but any medical care they get, they'd still have to pay the whole amount until they hit the separate $2,500 deductible on the medical side. Now, many plans actually just combine these two into one deductible. And if that's the case, it'll be described in this language here. When you're looking at Healthcare.gov, the prescription drug deductible row will have the information saying included in plan deductible. So that means it's a combined deductible. It doesn't matter if the expenses are prescription drugs, if they're doctor visits, if they're hospital visits. All of those will count towards the same amount, and it'll all count towards the $2,500 deductible. So in terms of copays and coinsurance, most of you all are very, very familiar with this. Copays are flat dollar fees, as you can see on the plan on the left. The plan on the right has some coinsurance included. And these are similar plans sold by the same company in Miami-Dade County, Florida. But in terms of coinsurance, the thing I wanted to bring up is some of the conversations we've been having with consumers. So sometimes consumers might see these values for coinsurance, and they might think that, oh, 10%, that's what the insurance company is going to pay. I have to pay the 90%. And so it's important we really clarify that. No, the 10% is what you pay. The insurance company picks up the rest of the tab. Another important thing that consumers often ask related to coinsurance is, okay, well, 10% of what? And unfortunately, we don't have an easy answer for that. The healthcare costs and the actual prices of each service are not transparent. Those are really contained within contracts between the providers and the different insurance companies. So we're not able to say that an ER visit, a 10% of that might be $200 or $50 or $300. So for some consumers, they don't like the unpredictability of what a coinsurance might be. Although the reality is most plans have some type of coinsurance for some of the services. And plans with more coinsurance tend to be cheaper. And then one of the themes we'll talk about is the fact that consumers are very, very price sensitive, will always be looking at sort of plans that are on the cheaper end of the market. And so these are the types of things that they might be seeing. And so it's just important to make sure we can convey what coinsurance means and how it might apply to a consumer. So another thing that's very important to consumers, of course, is the fact that there's different categories of prescription drugs, and the copay amounts will be different. So here's a plan from Bedford, New Hampshire, and it shows you that there's 4 different categories. There's the generic drugs, which tend to have the lowest copay. There's a preferred list of brand name drugs, which has the next higher copay. There's all other non-preferred brand name drugs, and so that'll have an even higher copay. And then lastly, there's this top category of specialty drugs, which tends to have the highest copay. So I do want to note that most insurance companies don't always list it this way. They often list them as level 1, level 2, level 3, and level 4 drugs, or tier 1, tier 2, and tier 3, and tier 4. And the reason that's important is because we're seeing some insurance companies put some generic drugs in the second tier, the preferred brand tier, and some of their brand name drugs they put in the generic drug tier. So these terms are no longer going to be as applicable, and we hope moving forward maybe they convert to the new nomenclature, which really identifies the fact that there's 4 tiers or 4 levels. Now, while I mentioned that there are 4 levels and that's how Healthcare.gov displays the information, the reality is that some insurance companies are taking some of these tiers and splitting them into sub-tiers. So as you can see in this example from Austin, Texas, there's a plan that has taken the generic drug tier and split them into a preferred generic drug and another one that's non-preferred generic at $10 and $20 respectively for the copay. Some insurance companies are taking that top tier of specialty drugs and splitting that into 2 tiers, preferred and non-preferred specialty. So instead of having 4 tiers, you could have up to 6 different tiers of prescription drug categories depending on the plan. Now it is true that if you're looking at 2 different insurance plans side by side, one might have 6 tiers, one might have 4. And if you're looking up a particular drug for a consumer, you might be able to find out that they're both covered as level 2, but that level 2 means different things to each plan. So just something to keep an eye out for. For this particular plan, when you're looking on Healthcare.gov, the way they display this information is here. You'll notice that for generic drugs, it doesn't list $10, and it doesn't list $20. It doesn't list $10/$20, or even $15, which is halfway in between. It lists $16. Last year, it used to list $17. So for whatever reason, the computer is putting this in as a note if there's a split drug tier. So I encourage you, if you see sort of a strange number in that row, especially for generic drugs, just to click on the summary of benefits and double check and see if, in fact, is it a split tier or is it just one prescription drug tier for generics. Now, one of the most important things I want to convey to you all is really the benefit of looking for plans that might exempt some things from the deductible. So we talked earlier about how consumers have to meet the deductible first before the insurance kicks in. Well, it turns out some plans have modified that. So here's an example from a plan from Green Bay, Wisconsin, and it has a $4,000 deductible. And you'll notice there's many services here for which the deductible applies. So you have to meet the $4,000 in deductible and out-of-pocket costs before you'd pay the 25% coinsurance for specialty visits, or the $40 for the brand name prescription drugs. But there's several services here, you can see, that actually the deductible doesn't apply. So that includes the primary care visit at $20 copay and the generic drugs at $10 copay. So here on day one, you're able to go and see the primary care physician at $20 without having to meet the $4,000 deductible. So they tend to call this first dollar coverage because you're able to get it right away as soon as you pay your first dollars in premium. Now, many plans actually might exempt something. They might exempt either the primary care or the generic drugs, and some plans exempt them both. And other plans might exempt even more things, like the specialty visits or other prescription drug tiers. And so this is one way that a consumer can balance maybe buying a plan that has a higher deductible, which might have a lower cost, but still gives them some access to basic primary care through the course of the year without having to meet the deductible. So one thing I wanted to remind you all, though, is health plans might describe this phenomenon in different ways. So they might say that primary care is exempt from the deductible. Or they might say that the deductible does not apply to primary care visits. Or they might say the deductible is waived for primary care visits. Or they might say it's $25 copay for primary care before the deductible. So this is a couple of different ways they might use this, but all of this means it just explains whether or not that service has to have the deductible met first or whether it's exempt. Last point I just wanted to note on this is just remember that no copay or deductible is ever applied for preventive care. So preventive care by law must be provided free of charge without having to meet a deductible or any copay. So one of the things this relates to is the HSA plans. And for those of you who don't know, HSAs are health savings accounts, and they're linked to a high deductible plan, and a consumer can put money into that health savings account, and it's pre-tax dollars, so there's tax advantage there, and it can roll over from year to year. And they can use the money in that account to pay for medical services as long as it's with an HSA-eligible plan. And to be eligible for an HSA, the plan has to have a relatively high deductible, and it cannot exempt anything from that deductible. That's just the rule for HSAs. So as you can see here, the plan on the left, this is from 2015, it's a Kaiser plan that is not exempted anything from the deductible. So the person would have to meet the $4,500 deductible before any insurance benefits kick in and they could pay the lower copay amounts. But most of the consumers we work with don't have a lot of extra money lying around to put in an HSA. So they're not able to take advantage of that tax benefit. So for our consumers, you can see the plan on the right, which is a very similar plan sold by the same exact insurance company and has the same exact values for deductible and copays, but it exempts certain things from the deductible, like primary care and specialty visit and generic drugs. Now, for this particular example, it's a particular age, there happens to be an $8 price difference, which is pretty modest. And so depending on how many people are in the family or how old the person is, the difference might be different. The amount of difference in cost might vary. However, you can see it's still not an extensive amount additionally to pay to get some services exempt from the deductible. So one of the things we might want to do when we're helping consumers is to look and see, is the plan HSA eligible or not? And if it is, if a consumer is not going to benefit from an HSA account, then maybe that might be a plan you sort of move past and look at one of the other plans. However, the HSA plans tend to be cheaper on the marketplace. So you'd be asking a consumer to look at some more expensive plans, but in this case, they'd be providing some access to services before the deductible. So some plans actually don't exempt a whole category of services from the deductible, but they might exempt a portion of it. So what I mean by that is something that we've dubbed the three-step copay. So here's an example of a plan where if you go, it's from Fairfax County, Virginia, you can go to the doctor for 3 visits at $45 copay before you have to meet the deductible. So we call it a three-step copay because you might be paying the 3 different amounts for the same service depending on the time of year. At the beginning of the year, you'd pay $45 for any one of those first 3 visits. After that, you'd have to pay the full cost of the visit until you meet the deductible. And once you meet the deductible, you'd pay 35% coinsurance for each visit. So here's another example of a plan that might have a relatively high deductible. In this case, it's $46.50. It's a bronze plan, so it might be somewhat cheaper than other plans in the market. And for someone who's relatively young or healthy, they might be looking at plans in that price range, but at least it offers some access to primary care, in this case 3 visits at a low copay amount of $45 without having to meet the deductible. So I want to show you how Healthcare.gov displays this information. So this same plan on Healthcare.gov you'll see here it lists it as $45/35% coinsurance after deductible. You'll notice it doesn't mention how many visits you get for the $45. You can either click on the summary of benefits and coverage to get that information, or this year, Healthcare.gov actually includes a very useful ability where it has something here on the right called Limits and Exclusions Apply. And if there is something, you can click on that, and in this case, the pop-up shows you that it explains there's 3 office visits that you pay at the copay amount before you meet the deductible. So that's a very useful additional link that they've included. So I do want to highlight one other type of plan that we're seeing on the marketplace, and this is actually in the other direction. This is a plan that they're calling deductible-only plans. And so several insurance companies have these on the market, and they're plans where the deductible amount, in this case $6,450, actually equals the out-of-pocket maximum. So once you've met the deductible, you've also met the out-of-pocket maximum, and that's why there's no copay or coinsurance after you've met the deductible. So in essence, this is sort of a catastrophic type plan. So if someone's very young and healthy and they want to buy a plan like this, which basically protects them from any major medical illness, that's certainly something they can do. And in fact, these plans tend to be the cheapest ones on the market. They're more likely to be in bronze, and they tend to be the cheapest. But if a consumer knows they have certain medical needs, or they know that they might want some access to routine primary care or some other services, then this plan may not be in the best interest for them. So it's just something to keep an eye out for. So I want to touch briefly on cost-sharing reductions. We spent a lot more time in previous webinars explaining how cost-sharing reduction plans work and sort of their value and their benefit. But I just wanted to highlight how you can kind of think of it in your head as well as explain it to consumers. So here's an example of a plan from Jefferson County, Kentucky. That's where Louisville is. And it's the Humana Silver plan that they sell. They sell one silver plan, and they have to include 3 different variations of the silver plan, as all insurance companies must do. So in this case, as you know, depending on your income, you'll qualify for a more generous version of the silver plan if your income is below 250% of poverty. So there's the 73% plan, there's the 87% silver plan for those under 200% of poverty, and the more generous 94% silver plan for those under 150% of poverty. In this case, the insurance company, they've lowered the deductible for the plans that are more generous. And so they lowered a little bit for the 73% plan, and they lowered a lot more for the 87%, and they lowered even more for the 94 version. In addition, they lowered the out-of-pocket max, and then they also lowered different copays. So you can see here the copay amounts will go down depending on which category of silver plan you qualify for. But they don't touch all the copays. In this case, they've left inpatient hospitalization at 20%, and they've left some of the prescription drugs at 50%. So each insurance company might tweak their silver plan in different ways to get the more generous version. So it's important to know that it won't always be the same way. But the most important point to note, and I want to include the other plans that Humana sells in this market, Humana sells a bronze, a gold, a silver, and a platinum. And you can see here the bronze is the 60% actuarial value, so it's 60% generous, and it has a very high deductible. And then the silver plan has a little bit lower deductible. The silver plan at 73% is slightly more generous than the regular silver, and so it has a slightly lower deductible. The gold plan is 80% generous, and it has an even lower deductible, but you'll notice that the silver 87 is even better than the gold plan. And in fact, the silver 94 is even better than the platinum plan, and in fact is the best plan available on the market. So the silver plans that are 94% for people below 150% of poverty tend to provide the best, most generous type of coverage in terms of cost sharing. So if a consumer is coming and they're looking at it, you can really explain to them if they're eligible for, say, the 94% silver, they're getting something that's even better than platinum. But the important thing is they're getting it at the same cost as a regular silver. Or if it's 87%, they're getting something that's even better than gold, again, for the price of silver. So it's sort of a way for you to think about this when consumers come in that have CSR eligibility as reason of why you might want to talk to them to explore the silver plans, even if there's cheaper bronze plans that they might be looking at. I do want to note that on Healthcare.gov, it's very hard to find out the exact type of silver CSR the person's eligible for. But I wanted to note here, this is one screen where when you're helping a consumer, it'll be after they've gotten their eligibility determination and after you've set their tax credit amount, but before you see the prices of the actual plans, there's a couple tutorial pop-ups that come up. And this is one of them, and in this box it shows that it says 94% silver. Or it might say 87, 73, or the regular base 70%. And that's one area where you can actually catch that information, and you can record that if that's useful. So now I want to talk about benefits. So as I mentioned, the Affordable Care Act really standardizes benefits across all health plans sold inside and outside the marketplace to individuals. But there are some places where they might be different in a bit. So one of them is prescription drugs, and the other one is what they provide for oral and pediatric care, pediatric, oral, and dental care. So I'm going to talk about that first. So while pediatric dental coverage is in fact a core benefit that must be included due to the Affordable Care Act, there is a rule that says that insurance companies do not have to provide it if they're standalone dental plans that provide it in the area. And in fact, in most markets, there are in fact standalone dental plans, so many insurance companies do not include it as part of their package. So you can see here the plan on the left, and this is from Atlanta, Georgia. It does not include any coverage for child dental care. And so it says benefit not covered when you're on Healthcare.gov and you scroll down to the dental section. The plan on the right, however, actually a Blue Cross plan does include it, and so it has values for coinsurance for the different services associated with it. So if a consumer wants to include coverage for their children for dental care, if they bought the plan on the right, they'd pay that premium, it's $336, and they would include all the medical care, but it also would include dental coverage for their kids. But if they bought the plan on the left, they'd pay the premium for that medical plan, but they'd have to buy a separate standalone dental plan to ensure that their kids have dental coverage. And that could be anywhere from a few dollars to $10 to $40. And the tax credit would not help cover that cost. So if a consumer is really interested in dental coverage, making sure you get a sense of which companies include dental care might be very useful to that search. So another area where benefits might differ is on something called other covered services. So this is a summary of benefits and coverage for a plan sold in Arlington County, Virginia. And it includes in it services that are not required by the Affordable Care Act, but that this insurance company has chosen to include. They're sort of value-added benefits. And you can see here that includes things like bariatric surgery and chiropractic care or routine hearing tests. And so each insurance company is going to have a different list of other covered services that they include. Now, there tend to be services that are less commonly used, but if a consumer is really interested, or say they are looking at infertility treatment, it'll be very useful for you to keep track of which companies in your area happen to include that and which ones don't. And in fact, you can take the different insurance company summary of benefits and coverages and you can track this into a table. And so I've actually done that here for the 4 insurance companies that are selling in Northern Virginia where we volunteer. And I've included the various services that are often included as other covered services, just have covered which companies include what. So if someone is interested in bariatric surgery, then we'll know which of the 2 companies that happen to include that as a covered service. Or infertility, which is only covered by one of the plans. So in terms of prescription drugs, when you're looking on Healthcare.gov, you know that there's links to things like the summary of benefits and other information, and then there's a link here for the list of covered drugs. When you click on that, that'll take you to the insurance company's website. Sometimes it might be a PDF, and so it's a site you'll have to scroll down and look manually to find if a drug's covered. Or in this example, which is a Coventry plan from Cook County, Illinois, you can actually type the name of the drug in and it'll find it. Or you can click on one of these links here for the therapeutic class, let's say for anticoagulants, for people who want to inhibit clotting, and it'll bring up the different drugs that exist. So things like warfarin and some other common drugs. And it'll include things like its dosage strength and the tier that it's included in, or if there's any other restrictions or step therapy or prior authorization included. So I did want to note, when we look up whether prescription drugs are covered, it's very important not just to see are they covered or not, but actually what tier it's in. So here's just an example, also from Cook County, Illinois, and here's the Coventry plan on the left, and we're looking for a particular drug called Humalog, the drug that people with diabetes might take. And you can see the Coventry plan covers it at tier 2, while the plan on the right covers it at tier 4. So that'll greatly impact how much the consumer will have to pay, depending on which plan they get. So now we can move on to provider networks. So one of the first things I want to mention is the network type. And these are terms that you guys may be familiar with. I'm sure if you've been helping consumers, there's the PPOs, the point of service, HMOs, and these more newer versions called exclusive provider organizations. And so there are some differences in terms of how they manage a consumer and whether or not they require PCPs or have referrals, et cetera. But the main thing that we really care about when helping consumers is whether or not these plans include coverage for out-of-network care. So as you can see, the PPO and the point of service, the top 2, they do allow you to get care from out-of-network providers. Whereas the bottom 2 versions, the HMO and the EPOs, do not allow you to get any care out-of-network except for emergency care. So if you go to an ER out-of-network, they will cover that. But most all other types of services you'd get out-of-network, you'd have to pay for the full cost yourself. So while insurance companies might differ in terms of whether or not they have PPOs or HMOs, and some companies actually sell both types of plans, the real gist of it is what is their network? Who are the providers you can see if you buy that plan? So just as an example, we're going to walk through a couple different plans to talk to you about how different they might be. So we'll start with a fictitious plan, Apple Health Plan, and it has the black dots represent doctors and the red dots represent hospitals. And so in this case, we're going to say that it has some doctors but not a lot, and some hospitals but not a lot. And so it might be considered what we call a narrow network. So that just means it doesn't have a lot of options. Let's say there's another insurance company, in this case Orange Health Insurance Company, that has also a narrow product. So it has some doctors but not a lot, and they happen to be different doctors. Some of them might overlap with the Apple company. Some of them might be much different. Some hospitals might be the same. Some hospitals might be different. But this same company might actually sell a different product. This is, let's say, made up their Select Network product. Let's say they have a different product called their Enhanced Network. So in this case, they have many more doctors. So we call this their Broad Network product. It has a lot of doctor options and a lot of hospitals. In general, the broader network products tend to be much more expensive. So you're basically paying for access to more doctors. And let's say there's another insurance company, Lime Health, which is an integrated model. And so an integrated HMO might be something like Kaiser or Geisinger. That's where all the doctors are located into one office or one medical complex, or they might have 2 or 3 around town and have some hospitals. So there's just a big diversity of how insurance companies might structure their networks. And it's not just different across insurance companies, but it might even be different across products sold by the same insurance company. Now, one issue is that when you're looking on Healthcare.gov, it is not really transparent if that insurance plan is a narrow network or a broad network. It's just not labeled that way. So some of the things you can do is either contact the insurance company to get a sense of which of their products happen to be narrower and which of their products happen to be broader. Again, in general, their more expensive products will be the ones that are broader. Or one of the things you can do is you can look online on the insurance company's website and take their different products and do a search for primary care providers within 10 miles of a zip code that you're working in, or number of cardiologists within 10 miles, or number of hospitals. And that number will be sort of a proxy of how big that network might be. It's not an exact science, but it gives you a sense of how big that network might be compared to one of their different products or compared to a different company. So a lot of insurance companies have been making their networks narrower, but some insurance companies, instead of making them smaller, have just sliced them up into different tiers. So as you can see here, there's different tiers for this product sold in Philadelphia County, Pennsylvania, and you pay a smaller copay if you go to a Tier 1 doctor and a higher copay if you go to one of the higher tiers. And I can show you for this same plan, here's an example. If you go to primary care, it's a $30 copay for a Tier 1 preferred provider, but it's a $50 copay if you go to a Tier 3 provider. But you can really see this difference when we're looking at this copay for if you have an outpatient surgery. It's $250 at a Tier 1 provider, and the deductible is waived. But if you go to a Tier 3 provider, not only is it 5 times as much for the copay, it also is subject to the deductible. So that could mean you're paying thousands of dollars more for the same exact procedure depending on which provider you go to. So if we're helping consumers by looking up whether or not their provider is in-network or not, it's not just enough to see if they're in-network, yes or no, but also what tier they're in if that network happens to have a tiered network. Speaking of looking at providers, one of the things we see in some areas in the country is when you're on the page on Healthcare.gov, you'll click on the provider directory link, and that'll open up a different tab that has the insurance company's website for their doctor search. And you can look at the plan name on Healthcare.gov, and you'll look at the plan name on the insurance company's site, and they don't always match up. And so it can be very frustrating because it's very important not to select an incorrect network here. You want to make sure the one you're looking at is, in fact, the plan they're going to buy if you're trying to see if a doctor is in network. So this might take some extra searching, or it might take some sleuthing, and in this case had to search and find out what network applied to this plan. So that can be very confusing and frustrating, and if that is the case in your area, it might be worth calling the insurance companies and having them give you a crosswalk of which plans have what networks. Now, even if it's very easy to find the network, here's just an example from the Bronx in New York, and here's just an insurance company, and you can type in a name of a provider there, and you'll do the search, and it'll come up and say that this doctor is in network. But when the consumer, after they buy the plan, they go in January, and it turns out the doctor actually isn't in network and doesn't take this insurance. And that's because there are some inaccuracies in the provider directories. And so if a consumer is really making a decision between plans based on whether or not a provider is in network, it might be worth double-checking that information by either contacting the provider or contacting the insurance company, or maybe even both, just to make sure that the consumer is making the best choice possible. So now I want to talk briefly about something that I'm sure most consumers and most of us are familiar with, which is the fact that insurance company premiums are really going to change a lot. There's a lot of flux. But I wanted to highlight just what that means when you're looking at plans from year to year. So here are all the silver plans sold in Northern Virginia in the area I volunteer. And here are the same plans sold from 2015. So we're looking at 2014 last year and 2015 this current year, before this year's open enrollment. The second cheapest silver plan is a CareFirst Blue Choice plan, and you'll notice in 2015 it actually became the second most expensive plan. And that's because things do change a lot from year to year. In 2016, heading up into next year's plans, it ends up staying as the eighth most expensive plan. So from year to year, plans are really going to change dramatically in terms of where they are on the price scale and what their actual prices are relative to other plans sold in the market. Perhaps the easiest way to explain this is, let's just, most consumers look at the cheapest 2 or 3 or 4 plans on the market. It's sometimes hard to get them to consider plans that are more expensive. So you can see here there's 3 cheap plans in 2014, and when you compare it to this current year, 2015, you'll notice that one of the companies has dropped out. And so it's different plans and different orders. And for 2016, once again, we have a new company coming in, and it's a different plan that's the cheapest, and slight differences in terms of their deductibles and their prices. So every year, the price range that a consumer is thinking about might involve different insurance companies and different ones of their products. So it really stresses the point of wanting to come back and shop every year. Even if they like their plan, there might be a better option available for them that happens to have all the same features they like but has a different price, a cheaper price. So with that, I'm going to turn it back over to Hallie to see if we have any questions before we go on to the second part.
All right, so we'll take some questions now, and some have already come in. And again, we'll stop at the end of the presentation and take more questions. But first of all, let's see. You went over this a lot, but just to kind of reiterate, are co-payments always exempt from the deductible, or does it vary depending on the plan? And also, does it count towards the out-of-pocket max?
Great. Thank you for bringing that up. So copays, it does vary from plan to plan. However, you probably brought that up because you might have seen some insurance companies that have a rule where they say if we ever have a copay for a service, that means it's exempt from the deductible. And we only have coinsurance for things that the deductible applies. Some companies do that. Other companies don't abide by that at all, and they'll list very clearly if it's a copay or coinsurance, they'll either list after deductible or they'll exempt it from the deductible. So it really does vary across. And sometimes the information on Healthcare.gov isn't exactly 100% clear. So it might have a copay amount of $40 for something, and it won't say after deductible. But when you look on the summary of benefits and coverage, it shows actually the deductible does apply to that service. So it's always good to try to double check some of this information. It is important to note that if the deductible is waived for a service, so let's say it's waived for primary care, and you pay $25 copay on day one, those $25 you're paying do not count towards the deductible, but they do count towards the out-of-pocket max. Anything you're paying out-of-pocket for any care you receive during the year counts towards the out-of-pocket max, as long as it's an in-network care. So in-network providers, it counts. If it's pre-deductible, post-deductible, copay, coinsurance, doesn't matter. It all counts towards it.
All right. Going back to the combined medical and prescription drug deductible versus a separate deductible, what are the benefits of a combined medical and prescription drug deductible?
That's a great question. So I might answer it slightly differently. The benefit of having separate deductibles, if there's, let's say, a $500 prescription drug deductible like we saw, if someone happens to have a lot of medical needs that are just prescriptions, but they don't need to really see the doctor a lot or go to the hospital, then if they fill those prescriptions and pay out of pocket, they'll reach that $500 deductible, and then they'll start being able to just pay the copay or coinsurance for their prescription drugs, and they won't have to meet the higher deductible on the medical side. I believe it was $2,500 in that example. So if someone really just has medication needs, that type of split model, a separate deductible, might be better. Now, most people don't take a lot of medications without seeing other things like providers, because usually you need someone to prescribe that for you. So one of the benefits of combined deductible is usually you'll have a very similar plan that'll have just a $2,500 deductible that's combined. It won't have a $3,000 deductible. It'll have a $2,500 deductible. So all the care goes towards it, but in this case, it's actually a lower amount. If they have a separate deductible, sometimes they tack on an additional amount for the prescription drugs. So you'd have to pay the $2,500 in medical plus the $500 in prescription drugs. So to meet both deductibles, you'd have to hit $3,000 in medical expenses. Whereas if it's a combined $2,500, you're hitting it at $2,500 and lower. So it really does depend on which situation a consumer sort of is in and how much they use medical versus prescription drugs in their expenses.
Perfect. If a plan is an HSA plan, but the consumer qualifies for cost-sharing reductions that lower the deductible and out-of-pocket costs, would the consumer still be considered eligible for an HSA?
So that's a great point as well, and it is true that the plan loses HSA eligibility if the deductible goes down below a certain level. And that level, I believe, is $1,300 or around there. So if a plan deductible was HSA eligible at the regular silver plan version, but you have a more generous version, let's say 94% silver, and that deductible drops down to like $500, it is no longer HSA eligible. Because what matters is what your actual deductible is, because that's the plan you're buying.
All right, and we'll take one more question now, and then we'll take the rest at the end of the presentation. So for preventative services, which are covered at no cost to the consumer, if someone schedules a preventative service such as a colonoscopy, but then during the procedure they end up having a more complex procedure done, such as removing a polyp or something like that, would the visit still be no cost to the consumer?
So it's another good point in that we have been hearing from consumers who are going for what they consider to be preventive visits or preventive services, but there is a place where, depending on how a provider codes it, if it is not considered preventive, in this case it would be therapeutic, so it would be treating the polyp, it wouldn't be coded as a preventive visit, and it would be coded at a different. Now, the visit might be treated as preventive and so be free, but then the actual code for the removal of the procedure, the surgical procedure to remove the polyp, might have a separate code, and you might get billed for that separately. So we're seeing that a lot in patients who go and get blood work done. So if you're getting your annual checkup and you get blood work, that's fine. But if one of the things on the blood test happens to relate to something you might have had, let's say you had a heart issue 3 years ago, well, that's considered a sort of a monitoring or a follow-up part of the test. And so part of the test might be subject to a copay, part of the test might not. And so I think providers are still getting used to this phenomenon, and it's true that they may not always be coding it right, but you may hear consumers getting bills when they think it should be preventive. And if they really think there's an error, it is worth challenging it both with the provider and the insurance company.
And I'll add one more question. Will the summary of benefits and coverage, will those show the cost-sharing reduction variations in the coming enrollment year?
Yes, and so prior to now, the insurance companies could voluntarily include the summary of benefits and coverage documents for their different silver versions that are more generous. It wasn't required. Many companies did, and we found it a lot when we saw on Healthcare.gov, but some companies did not, and so it would be very frustrating if you're sitting with a consumer. Healthcare.gov would have it listed as the lower amounts in the cost-sharing reduction, but if you needed more clarification, you wouldn't get it unless you called the insurance company. But as of this coming year, for 2016, they are required to include it, and so we have seen places where last year we didn't see it, and this year I've seen the same insurance company and they include it. Sometimes I'm not sure if all of them are loaded, so if you catch a place, a company that doesn't have their CSR versions, it might be useful. You can shoot us an email. We might want to let that state know or let the Healthcare.gov know so that they can update that.
Perfect, and we'll continue with the presentation and take more questions at the end. So again, just type any questions that you have into the Q&A box. Thank you.
Great. So now, before we get started on some of our interactive web exploration of some different scenarios, I wanted to just highlight some of the new tools available on Healthcare.gov. They're very exciting and have the potential to really assist your process when you're helping consumers, or at least reduce the time it takes on some of them. So the first one is what they're calling the out-of-pocket cost calculator. And this is a screen you'll see when you're sitting with a consumer. This is on the window shopping page, and it might only be limited to the window shopping page. So if a consumer is interested in using this tool, you might have to do this first before you apply. So it'll ask you if you want to estimate the total yearly costs, and you can click on that. And then it'll let you decide whether or not you think that your use of health insurance is low, medium, or do you use health insurance a lot? Are you a high user? So for low, what they do is they take the age and the gender of the person, and they take into account, if you say low, they say that a male that's age 40 in this case uses, on average, across the population, 1 doctor visit, 2 prescription drugs during the course of the year. But a male age 40, if they describe themselves as a medium user, you can see it's more doctor visits and a lab test and some prescription drugs. And if they identify as a high user, you can see that it's even more doctor visits, more labs, maybe 1 day in the hospital, and some other medical expenses. So this is going to factor into how they might show information on the plan page, which we'll see in a second, and helps you sort the plans not just by their premium, but by some of these other factors in terms of your overall cost. So if we were to put someone in when you get to the window shopping page, here's the plan. In the bottom left-hand corner of the box, it now includes some new information that wasn't there last year. This is the estimate of your total annual cost. It includes the total amount that's related to your premium, so that's just the $490 premium times 12 months, in this case $5,800, and then how much they think you'd be spending in things like deductibles and copays and coinsurance. So based on this assessment, it thinks that this person would spend about $1,257 additional dollars in copays and coinsurance and deductible, so it lets you see that this plan would overall cost you $7,141. Now, this current site is set to default to sort by premium, but you can click up there and now sort by what's called out-of-pocket cost, OOPC. Or sometimes you might look at it, it might say yearly cost in it. It's actually different depending on different ways we've seen it through the course of the last week. So if you change it to out-of-pocket cost, it'll now resort all of these plans based on this value, the $7,141. So there could be another plan that costs more money per month, but maybe has a much lower deductible, and so the person ends up paying less if they buy that plan. So it's a very exciting, useful tool you can use, although we do caution it's still in sort of its initial phases, and we know that it's providing population-based information that may not be tailored to an individual. So when we do our web demonstration, we're going to show you how we sort of tailor it to an individual. Another tool that exists is their provider search tool. So it's only available for 1 out of every 4 consumers who are applying because it's being beta tested, and we hope over the next couple weeks or so that it'll become available for everybody. And so if you're with a consumer, you may see this screen pop up that lets you include information about providers. So on the screen, it'll let you type in a name of a provider, and so we'll just use a sample name, and it'll then pull up all the people with that name, and it'll based on closest to furthest away. And so you can pick on one. In this case, let's say we pick the first listing here, Todd Gray, an internal medicine doctor. And when you actually go and look at the plans then, it'll now have this other box that includes whether or not that provider is in network or not. Or in this case, we added a hospital as well, because you can include multiple providers. And so it says for this plan, they're both out of network. But when we scroll down, there's a different plan that's more expensive that actually has the provider in network, the doctor, but doesn't have the hospital. So it's a very useful tool for you to be able to sort of integrate that provider search into your search for the plans if a consumer has a particular provider that they want to keep. So now that we've looked over those tools, now we're going to go ahead and start our web browsing demonstration. To do so, we're going to use this document as sort of our backdrop. This is the Marketplace Plan Comparison Worksheet. It's something we developed over the past couple years and have refined thanks to a lot of great feedback from assisters like you. It lets you compare several plans side by side in terms of things like their price and their deductible, and then the cost-sharing amount for many common services that people need, like doctor visits and prescription drugs and hospitalizations. But it also has a lot of blank fields at the bottom that you're able to use to tailor this search based on a particular consumer's needs. So things like if they're interested in a particular doctor, or if they're interested in whether or not pediatric dental is covered or not, you can put that in as a consideration and then check yes or no for the different plans you're looking at. This is available both in English and Spanish at our website on healthreformbeyondthebasics.org. So let's get started. Our first consumer is Sasha, who's 37, and she's from Bellevue, Nebraska. She makes $30,000 a year, and so in all likelihood is over the categorization limit for getting cost-sharing reductions, but she probably gets some tax credits. So we can go online and we can actually do shopping with Sasha. So here we're going to be shopping using the window shopping. This is the bottom left-hand corner, see plans and prices on Healthcare.gov. If you were actually helping a consumer, you perhaps would have already applied and gotten the tax credit amount, and you'd be looking at the actual the selection phase. But the information's all the same. So here we're going to look up plans, and we're going to put in her zip code. And then it asks you if you already have a plan or not. If you do, it asks you if you want to input in the information for that plan, if you want to keep it. In this case, let's say she's new. She doesn't have any coverage. So we'll say no. It asks if you're shopping for just you or for you and other people. In this case, we'll just say it's her because she's single. We'll put in her age and gender. And then it asks for income. So we'll go ahead and put in her $30,000 a year. So now it says that she qualifies for a tax credit of about $95 a month, and in fact this window shopping page is relatively accurate, within $1 or $2 of what you actually get when you actually apply and get a determination. So with this amount of information, we can actually go back to our consumer and onto our form and put in the information on the top of the page. Her name, her tax credit amount, and the fact that she's not eligible for any cost-sharing reductions. So now we can go ahead and fill out some other information about her. So we can go ahead and look at plans, and in this case, they again ask if you want to estimate your total out-of-pocket cost. And so we'll go ahead and do that for her. Let's say she wants to see what that means. And when we talk to her, she says that she's pretty healthy, so she feels like she could put in low. And she's really concerned about cost. She just wants to pay the lowest cost amount, maybe something $100 or less. And many consumers come to us with preconceived notions of how much they feel like they can afford and really looking for the lowest cost. So in this case, we'll continue, and we'll go ahead and see what plans exist. And so right away, we see the cheapest plan available for her is a $140 Coventry Bronze plan, an HSA plan. So if she was coming in hoping to pay less than $100, automatically we know that any of the plans on the marketplace are going to be more than that. So we can actually click on this plan, and we can look at more of the information. This is one of those plans where the deductible equals the out-of-pocket maximum. So all of the copays are no charge after deductible. So this is really sort of like a catastrophic plan. So we remember that we put in her information on her yearly utilization. So we can actually go here and sort by yearly cost. I mentioned sometimes it's listed as OOPC and sometimes as yearly cost. So here we do that, and it turns out when we resort, this same plan is still the cheapest. So maybe she says, okay, if that's the cheapest by premium and by yearly cost, I want to keep that plan. So we can scroll down and see there's some other plans. There's one that's 143, there's one that's 144. But maybe she says, well, what if my usage is actually medium instead of low? How would that change? So right here in the bottom left-hand corner, we can click on Edit, and we can edit that. So from low, we can change it to medium and update it, and now that shows. Even under the medium scenario, this same Coventry plan ends up being her cheapest option. When we scroll down now, here's another plan that's actually more expensive than some of the other plans, but it happens to have some things exempt from the deductible, in particular, primary care. So she could get primary care at $15 a visit without having to meet the deductible. So maybe she says, okay, these are two options I might want to look at, but we're noticing that these deductibles are very high. We can record this information onto the form. So here's the Coventry Bronze. That's $140 a month and has a particular deductible that's very high, and it equals the out-of-pocket max, so there's no charge for cost sharing after you meet the deductible. And here's the $153 Bronze plan from Coventry that's a little more expensive, has an even higher deductible, but it exempts primary care from it. So these are two options if she really wants to just pay as least possible per month, but like we said, they have very high deductibles. So maybe she's a little concerned by that. And so we mentioned, well, we can go back and we can actually look at the silver level. Let's go here and click on silver. And when we do that, we see that there's a $225 United Silver Compass plan that's listed as the cheapest because of the utilization. But in terms of premium, it turns out there's a cheaper plan. It's $205. It looks like a lot of things are actually exempt from the deductible. So maybe she says, even at $205, that seems like a lot of money, so that's probably the upper limit she can go. It has a lower deductible of $3,500 compared to those bronze plans, so we'll include this plan as well. So here's now the $205 Coventry plan that has a lower deductible, and it exempts not only primary care, but also specialty visits. So here she has a little more information about the plan. Maybe she said, again, she's young and healthy, so she's not really concerned about other things, and so she might feel comfortable making a choice, or she might be very overwhelmed and not sure what choice to make. And she might even ask you to tell her which plan to buy. So this is a very good time for us to remember that as assisters and navigators, we can never tell a consumer which plan to buy. We can never recommend a specific plan. That's prohibited by federal and state law. However, you shouldn't feel so shy to talk in great detail about these plans and about their needs and their priorities. So while you can't recommend a particular plan, you can certainly ask them what's most important to them to help them figure out what might be the best plan for them. So in this case with Sasha, we might talk to her about some of her priorities. Is it to have just the cheapest monthly payment? That's what she probably came in thinking. Is it having a manageable deductible? Is it having low copays or coinsurance whenever you go and see the provider? Is it having some first dollar coverage, so something exempt from the deductible, especially things like primary care or generic drugs? Or is it having that lowest yearly cost from that out-of-pocket cost calculator that now exists on Healthcare.gov? For every consumer, their priorities might be different, and they might value some over others. And some health plans might be better at some of their priorities, but worse in other areas. And so it really is a balance or a trade-off for the consumer to make. But in talking to them about what they value most and helping them explain which plan meets those values, you can really help empower them to be able to make that decision on their own and become a better consumer in the future. So now let's go to our second scenario. And this is James and Ann from Chicago, Illinois. Their combined income is $23,000 a year, and so likely they're going to be eligible not just for tax credit, but probably for that most generous CSR version, because they're below 150% of the poverty level. So we can go ahead, and we already put in some of their information on Healthcare.gov, and we see that they're likely eligible for a tax credit of about $446. And down below it, it indicates that they might be eligible for these savings on out-of-pocket healthcare costs. That's the language they use to tell you that they're probably eligible for cost-sharing reductions. So we can go again on Healthcare.gov on our form and put in the information. Their tax credit amount, how many people are in the plan, and in this case, the fact that they're probably eligible for 94% CSR. Again, if you were shopping with them on the actual page after applying, you'd know that for certain. Now, before we look at plans, we wanted to note that our form has some basic things that people tend to look at, but not everything, and every consumer might be different. And maybe they say that they happen to have some utilization and they happen to use some healthcare services, and some of the things they do is they get lab work, every year, and they also get some x-rays done for various reasons. So we can include that on our form and make sure when we're looking at plans, we'll compare them on these factors as well. So now let's look at the plan options. So in this case, we already showed you the estimate of the out-of-pocket costs. We'll just skip this for this particular example, although we'll come back to it. Now, this happens to be one of the four, we happen to get the doctor search, and I told you it comes up 1 out of every 4 times, and so we weren't sure if it would pop up, and it so happens that it does. And one of the things we were going to do in this example is, in fact, look for the provider. So in this case, we're going to use it. So the provider that they provided us with is a doctor named Dr. Gaziano. It's a primary care provider. So we're going to search for this doctor, and in fact, it does come up in Chicago, Illinois, Dominic Gaziano, an internal medicine provider. So we can click on it, and we'll include it in our search. If we had other providers, we could include that as well, but in our example, we'll say they only had that one PCP. So we'll say no, and we'll continue. So now when we go to plans, it's going to include information about whether or not that provider is in network. So the first thing we see as we're looking at plans is that there's a free bronze plan. It is $0 a month. And that's because the tax credit they get is actually bigger than the cost of this plan. But you'll notice it has a huge deductible. So we might remind them that they're eligible for cost-sharing reduction, so why don't we look at the silver category? And if they really want the free plan, we can always come back. So we click on silver, and now it just shows us the different silver plans. So here's a $72 plan from Ambetter that has a $1,100 deductible, and it does not include the provider in network. If we scroll down, we notice there's another Ambetter plan that's $79. It's a couple dollars more expensive, but it actually has no deductible. So that might be very attractive to them. It also has very low copays, $1 for primary care and $1 for generic drugs. If we wanted to see more information, we could click on it and see the plan detail page. But we already know that we got some of that information prior to the webinar, and so we know that we're going to look at this plan. So when we scroll down, there's other companies. This is Ambetter, so we know that they have a couple other plans that have higher deductibles. But in this case, we might want to find something else that has very low deductibles. Here's another Ambetter plan, but it's actually the same one we were looking at. It just includes vision and adult dental. And let's say in this case they feel like, if they're interested in that, we'd include it. But in our example, let's say they're not interested in that and they don't feel like paying extra money just for that. So when we scroll down, the next plan we actually see is a Blue Cross plan. It's $215. And let's say they're interested in seeing a variety of different insurance companies. So we might look at this one. Although you'll notice the price jumped up quite a bit. So this plan has a much more expensive price. It has a $600 deductible. It's not free, but it also has relatively low copays. So we might include that. And if you keep scrolling, here's another plan from Land of Lincoln, and it actually has no deductible. And so maybe they say, yes, we'll want to look at that one. This particular insurance company doesn't have any provider data integrated to Healthcare.gov, so it doesn't tell us whether or not the doctor's in network, and we'll come back to that in a second. So let's say we'll just go with these 3 plans to look at. We have the $79 Ambetter plan that has no deductible and relatively low copays, but a lot of co-insurance for some services. We have the much more expensive Blue Cross plan that has a $600 deductible, but it seems like it only applies to certain things, and lots of things are exempt from the deductible. And then lastly, there's this $272 Land of Lincoln plan that has no deductible and modest amount of copays. So again, if a consumer feels like they have all the information they need to pick a plan, that's fine. But one of the things you'll want to talk about is if they mention they had a provider or if they mention they've had utilization, chances are they might know a little bit more about their health needs. So we can talk again. And so in this case, they already mentioned to us that they have a doctor, Dr. Gaziano, who's a PCP. And let's say they also mentioned that James has a family history of heart disease. And so he's interested in finding a cardiologist. He doesn't have one now, but he's curious to get one. And so we can look and see how many cardiologists do each of these plans have in network. And then lastly, let's say James mentions that he happens to have type 2 diabetes, and so he takes this particular medication, metformin, for it. And so we can look and see how each of these companies treat that drug. So we already kind of did the provider search for the insurance companies, but we want to show you how to do it manually in case you'll need to. So on Healthcare.gov, you can start with Land of Lincoln. When you're on the site page for this plan, right here is a link to provider directory. So we can click on that, and it'll take us to the insurance company's website. And as you may get when you're actually looking for plans, the insurance company's website might take a while. While we let that load, let's go back and look at a different plan then. Let's look at here at the $79 and better plan. And let's click on their provider directory. So here it allows us to put in the zip code for the consumer. And in this case, they happen to have a tour. And it allows us to select the network. In this case, we know we're in Illinois. And we can do a quick name search. And here we'll type in the name of the provider. So you'll notice this is not Dominic Gaziano, so it's a different provider. So it turns out that this doctor is not in network. Now, we already saw that when we used Healthcare.gov. So for Land of Lincoln, we can go ahead and look up there. So for their site, it makes you actually ask if you're already a member or shopping for a plan. So in this place, we'll say we're shopping for a plan. And it does seem like this site is quite slow compared to before. Well, rather than waiting for it, we'll go back to our form and record the results, and we can let you know how this turned out. However, if you're actually helping a consumer, you very well may run into the same problem where you're trying to look up information, and the insurance company's site will either be down or delayed or for whatever reason. So frankly, this is as accurate as a picture as we'd get. But in this case, it turns out that this particular provider is actually in network for Land of Lincoln. But as we noticed when we searched offline, it wasn't in network for both Ambetter and for Blue Cross Blue Shield. But now we can actually look up cardiology searches. So in this case, we'll go back to our site, and we might use Blue Cross Blue Shield. So the Blue Cross plan, which is $215 a month, we'll click on their provider directory, and it'll ask us what network are we looking at. And so in this case, we need to pick the Blue Cross plan that is the Blue Care Direct in collaboration with Advocate. So that's the one right here. That's the name of the plan, so we make sure we match that up. And down here, we're going to type in the name of the provider, or the cardiology, which is the specialty that we're looking for. So we'll start with the zip code. In this case, we're looking for doctors. The specialty we're looking for is cardiology, so we'll put cardiovascular disease. We'll hit search. And so now it'll come up with results, and it shows us there's 132 results. Maybe we want to expand that. So we can actually expand it to 15 miles. So we'll do 20 miles, just to see how many are totally in the area. And it turns out that there's 154 cardiologists within 20 miles. Now maybe they might want to know how many are closer to home. In this case, how many are within, say, 10 miles. So we can go back and do that as well. So we can change the radius to 10 miles and update the results. And here it shows us that there's 52 within 10 miles of their zip code. So we can do the same searches with the Ambetter and the Lincoln Mutual plans and put that information here. And so you can see that the Blue Cross Blue Shield happens to have a lot of providers in terms of cardiologists. Ambetter has some, and Land of Lincoln actually doesn't have that many within network, within that radius. And lastly, we can look up the prescription drugs. So on the site, we'll go back here to our Healthcare.gov site. In this case, we'll look at the Ambetter plan. And instead of clicking on Provider Directory, we're going to click on the bottom one, List of Covered Drugs. So when we do that, we mentioned that some insurance companies have a PDF you'd have to search by hand. In this case, they have the 2016 Preferred Drug List, and it pulls up their PDF. So to find it, you can either scroll down and try to find the particular drug you're looking for, but as you can see, that's quite complicated. So you can generally type Control F, which gives you a search field in a browser, and type in the name of the drug, metformin. And so now it'll find all the places on the page where metformin is. In this case, it shows us that they do have metformin covered, and it's in Tier 1 generic category. So we can do similar searches with the other plans, and again, record that information on our form. And you can see here, Ambetter covers it at Tier 1. Blue Cross Blue Shield happens to have different formulations of metformin at different tiers. And Land of Lincoln actually happens to have that split tier generic, and so they have one version in Tier 1A and one version in Tier 1B. So now, once again, we have a much more complete picture of these plans and can do sort of the same thing we did with Sasha in terms of talking about this family's priorities. And so that includes all the same priorities we talked about with Sasha, but additionally things like if they have a current doctor, is that doctor in network or not? And how important is it for them to keep seeing that doctor versus switching? Let's say they want to know about the size of network, whether it's a broad network or narrow network, or in this case, the size of a particular specialty like cardiology. And then if they happen to have prescription drugs, is that drug covered, and if so, at what tier? Once again, every consumer is going to balance these different values differently, and they might prioritize some over the others. But through talking to them about their priorities, you'll help them sort of narrow down among these plan options which one makes the most sense. So now let's go to our last example, and that's the Green family, and they're from Asheville, North Carolina. They make $45,000 a year and have 3 children, and we're going to say the younger 2 children, based on their income, actually do qualify for Medicaid. So when we're shopping with them, we're actually going to go shopping for the older 2, the parents and the oldest child. So here we have, when we already put in their information, it confirms that the younger 2 children are probably eligible for Medicaid, and let's say in this case they already were on Medicaid. And so the family is looking at a tax credit of about $843 a month. And it also looks like they're eligible for cost-sharing reductions. And in this case, we happen to know that based on their income level, they're probably eligible for the 87% cost-sharing reductions in the silver level. So now we can continue. And in this case, it asks us again about the utilization, and we might say yes. We'll go ahead and say yes. And maybe all of them tell you that they're low. So we can put low. So this is for the husband, who's 43 years old, male, and it shows you here what his low utilization is based on his age and his gender. 1 doctor visit, 2 prescription drugs. And now we can do it for the wife and put low, and you'll notice it actually has more utilization. Again, they index it based on age and gender. So in this case, the computer algorithm says that a female at the same age happens to might use more care on average. More doctor visits, perhaps more prescriptions. And again, each child then will have a particular profile based on their age and gender. And for all the family members, we'll just put low, because they think they're relatively healthy. So now we can go down and go ahead and look at their plan options. So you'll see right away, one thing I should remind you is, as every consumer does often, they'll come in and really be interested in finding the cheapest plan possible. They're very price conscious. So when you do this, you'll see that the first thing that pops up is a plan that's $13 a month, a bronze plan. It has a very high deductible, but it's free. And it also has the cheapest yearly cost here. If we sort by the cheapest yearly cost, it ends up being the cheapest one at $13. So let's say they're interested in looking at that one. Again, it's very hard sometimes to convince a consumer if they see a price like $13 to think about anything else. Now there's some other plans here. There's another United Healthcare plan that happens to have a lower deductible, but you'll notice it ends up being the same exact yearly cost because it has the deductible phase is still pretty high. Let's say they look and they want to look at some other insurance companies. And so here's another plan. It's an Aetna plan. It's $19. Again, very cheap, really huge deductible. And let's say they want to look at this one as well. But we remember that they're CSR eligible, and so we're going to want to suggest that they look at silver plans. Maybe we might have suggested that at the beginning, and we might have only looked at silver. Maybe they really wanted to find a cheap cost plan. But when we add the filter for silver plans, we get here the cheapest one is $132 Silver Care Compass plan. It has a lower deductible of $1,600 compared to those $12,000 deductible ones. And it also looks like it exempts some things from that deductible, like primary care and specialist and generic drugs. So let's say we want to look at this one, and we could look at maybe others, but they say $132, that's way too much. They're not even sure if they can afford that, so they don't want to let us look at any more. So for now, we can go ahead and look at these 3 plans. So we have our $13 United Healthcare plan that has a pretty high deductible and nothing exempt. We have a $19 plan from Aetna, which has an even higher deductible and also nothing exempt, but it's one of those deductible-only plans. And then we have this $132 silver plan, so it's a lot more per month, but it actually has no drug deductible, and it has a modest $1,600 deductible for medical side. But that deductible doesn't even apply to primary care and specialty care. So now we can see if they have any other needs. Again, we might have talked to them about, do you have any doctors? And maybe they say no. They were uninsured last year. Do you have any healthcare uses? Do you take any medications? And maybe they mention, yeah, we do have some. So maybe some of the things they bring up is they're interested in out-of-network coverage. They're not sure if that's something they need, but they're curious, does any of these plans have it? And we actually don't need to look that up very hard because it's actually in the name. It's there right there in the row 3. We know the 2 HMOs don't have it, whereas the center one, the Aetna plan, is a POS, so that actually has out-of-network coverage. So then we'll talk to them more about their health care. Maybe they say, okay, we're not sure how much care we use, but you know what's really important to us is that our mother can get care through a provider who speaks Spanish. So maybe they want to know, do you have any Spanish-speaking primary care providers? And that's something we can actually look up for them. So here on Healthcare.gov, we can go onto the United page, and we can open up the provider directory here. So we'll click on the link, and it takes us to their page. So here we're looking for medical providers, so we'll click on that, and it asks us for a zip code. So we'll put in the zip code for Asheville, and now it says, what do we want? And in this case, we want people. We want a particular provider. We're looking for primary care, not specialists, and we're looking for a primary care physician. So when we do that, it says that there's 439 total primary care doctors near our area, in this case within 20 miles. But remember, we want, well, those who speak Spanish. So we'll go to the language tab here and click on that, and scroll down and find Spanish and click on it, and it'll update our results and show us that there's 29 Spanish-speaking primary care providers within 20 miles. Maybe they want to know some that are closer to home, so we can actually go ahead and lower that. So we'll change it to 5 miles, and it turns out that there's 16 primary care providers who speak Spanish within 5 miles. So we can do the same for the other plan, and again, record that information here. So you can see United has a decent number within 5 and 20 miles, while the Aetna plan has some within 5 and 10 miles. So another thing that they might be struggling with is maybe they feel comfortable looking at these, and maybe they don't want the Aetna plan because they're really saying here's this cheap bronze plan that's very, very inexpensive, and then there's this much more expensive silver plan. And how do they make a decision on which one's best for them? And a lot of consumers will face this. So do they pay a small amount a month but just pay for most of the things out of pocket? Or do they buy a more expensive plan that has a smaller deductible and some pre-deductible coverage? So we can get rid of the middle plan, and we can actually talk through them. Maybe, what do you expect in terms of your healthcare utilization? So some people, if they have existing health conditions or they already have a track record of how much care they use, they can estimate exactly how much, and you can do that with them. Maybe in this case they're not sure because they were uninsured last year, but you might say, okay, well, how much care did you use last year? And maybe they finally reveal to you some things. Maybe in this case they reveal that across the 3 family members, they happened to visit the doctor 4 times, and so they knew how much that cost. And maybe they happen to actually have a lot of generic prescription medications they take. So there's 4 different medications each month, and it actually adds up quite a bit because it tends to be quite expensive each month for each one. And then one of the family members happened to have a hospitalization that had a pretty decent hospital bill, $4,000. So we can see how did they compare if they had either of these plans last year. So if they had the bronze plans last year, you take the annual cost of the premium, and that comes out to $13 times 12, $156. But then all the other care, you see the deductible applies for everything, so they'd have to pay out of pocket for all of that care until they reach $8,400. So they'd pay the $6,400 that all of these services end up calculating up to. So when you add that together, it's a little over $6,500 they'd be paying out of pocket for the total cost for the year. So the silver plan on the right, it's $132 a month, so times 12 equals over $1,500 just in premium alone. Now the hospital bill, they'd have to pay the first $1,600 of it because that's what their deductible is. But the balance, you see, is a 20% coinsurance for hospital stay after you meet the deductible. So that would just be an additional $480. Their primary care visits are $20 each, and their generic drugs are $10 each times 4 times 12 months equals another $480. So when you add all that up, it ends up being just over $4,200. So if they happen to have the silver plan last year, they would have saved a lot more money than if they bought the bronze plan. Now, everyone's healthcare utilization might change year to year. Certainly you can't anticipate a hospitalization, but it's a way you can help them understand based on what they feel comfortable with or how much risk or how much care they might use, why you might want to spend more money for a particular silver plan because it has more coverage pre-deductible and a lower deductible. So with that, we're going to talk about some final priorities for the family. So that includes things like if they want out-of-network coverage, is that important to them? So look for a PPO or a point of service. If they have a particular preference for a language spoken by a given provider, in this case Spanish. Or if they want to know what that lowest yearly cost is not based on the out-of-pocket cost calculator, which sort of uses aggregate data from a population, but in this case, tailoring it based on their specific actual utilization they anticipate and getting a figure between the plans. So with that, we're going to take some questions, but before we do, I just want to mention that there's another tool out there from some of our partners. It's from Enroll America, and so they have a Plan Compare tool as well that's similar to Healthcare.gov, but actually lets you go into greater detail. And so it lets you put in information about the family and really tailor the search of what their utilization is by putting in how many doctor visits do they have, how many medications do they take. And so that's something you can get on their website at getcoveredamerica.org/explorer. And they're going to be doing a webinar on this in a few weeks to really talk through about this, this really great tool that's available now for anyone who wants to help consumers use it. So with that, we'll go ahead and take any last questions we have.
So a couple of questions, and if you have any, just type them into the Q&A box. One question is, how do you clarify if a doctor is in-network? If an insurer says that they are in-network, or the in-network provider tool says that it's in-network, but the provider says that they aren't, how do you know which is correct, and how would you go about clarifying that if that is something that is really important to a consumer?
So in general, if you contact a provider or the insurance company and speak to someone on the phone and they give you confirmation that they're in-network, you can feel relatively confident about that. However, I will say there are times where providers think they're in-network, or an insurance company tells you that provider's in-network, and you buy the coverage and you go try to use it next year, and it turns out they were all mistaken. But the difference is if you get that information directly from the provider or the insurance company, you at least have a record of it, and you can try to request it in writing as well, so that if they're wrong, you have some recourse, and so they can either agree to cover the care at the provider, even if they're out of network, or you can perhaps try to get an ability to change the plan if you're still in January and the open enrollment hasn't ended. But it is a very big frustration for consumers who are trying to use this information to pick a plan based on who has their provider. And there ends up being either inaccuracies in what's online, but even what the provider and the insurance company tells you. So you can do as much due diligence as you can, but there are times where they're all wrong, and then it really ends up being sort of an appeal or a fight you have to take directly to the insurance company.
All right. Are there? So we mentioned that there are standalone dental plans on Healthcare.gov. Are there any prescription drug only coverage plans on Healthcare.gov?
No, so prescription drugs is considered entirely an essential health benefit, so all plans have to include not just those, but all the other coverage. So for primary care, specialty care, rehabilitation visits, maternity care, they can't parse out any of the other services into a standalone plan. It's only the dental coverage that has that, and that's because of the way the law was written.
Perfect. And with that, I think we're going to bring this to a close. Again, if anyone has additional questions or something that didn't get answered, please feel free to email us, beyondthebasics@cbpp.org, which is on your screen right now. With that, I will bring this to a close, so thank you so much for joining us today.